Well, hello and happy Thursday on this 2021 Healthcare Project Delivery Conference. Very excited here with Clinica Sierra Vista to join this panel discussion and be part of talking about culture change and transformation. We're going to be diving into how we have done that here at Clinica Sierra Vista, the goals we set out to do several years ago, how those are implemented today amid this COVID age. And so excited to share that with you. We are joined here. My name is Tim Callahan. I'm the Director of Communications at Clinica Sierra Vista. I'm joined with Stacy Ferreira, our Chief Executive Officer, Abel Victorio, our Chief of Innovation, as well as Jesus Gonzalez, our Project Director. We have a lot of great information and great topics to dive in with you today. And so we want to jump right in and talk about how we have really worked this through the last few years and leading into 2021, and what a transformation and what a process it's been. Let's start with Stacy. Stacy, talk a little bit about why we started this transformation, coming to this point, realizing what needed to change, realizing internally what processes needed to be updated to deliver the best care to our patients. Talk about what's this meant to our delivery system.
Absolutely. Thank you, Tim. So Clinica has gone through quite a transformation in the last couple of years. In 2018, we had a long-term CEO leave our organization and new leadership coming into place. It was an opportunity for our organization to take a moment and kind of pause and reflect on where healthcare is going and what's really changing around us in our dynamic and the community around us. So Clinica Sierra Vista, we are celebrating our 50th anniversary. Our mission is to take care of patients that are low income, underserved, uninsured populations, homeless, the disenfranchised, and patients in our community that really need services that are really tailored to their needs. So we kind of took a quick, what we would call pause and reflect, and look at how we've been doing the last 48 years at that moment, and where do we need to be or want to be. And it became very clear that we were on a very transactional based kind of healthcare model where patients would come in, we would treat their episodic care and send them back out the door, and that we weren't really making a difference in the health outcomes that our patients were having. And so we took a minute to kind of go, okay, this is a pivotal time for us to recognize that healthcare is changing, and the industry is moving towards a compensation model that really focuses around the health outcomes, not just those transactional services. And so how can we create an environment and an organization that is ready to address that for our patients? And so really focusing on the well-being of our patients and moving the needle on the social determinants of health of our populations. And so, we recognize that our patients come with a lot of challenges. So they have transportation barriers, lack of access to healthy foods. Our providers can write a prescription, and is it actually going to get filled? Does the patient have the money to go down to the pharmacy and fill it? Can they get down to the pharmacy and fill it? Are they in a place that they can actually really help take care of themselves and partner with us in a way that, can make that difference? So we're really working on creating a model to meet our patients where they're at, and having those conversations at a whole different level.
Yeah, that's great. And Stacy, you talk about the whole health perspective and really how important that is to the population base that we serve. I want to bring in Abel for this next discussion about really what we did to set out to look at this as an organization in terms of the whole person care, eliminating waste, the process to which we were able to transform a lot of these goals. Abel, talk about just all-encompassing and how we were able to really identify the weaknesses and focus on the strengths.
Yeah, so, developing a compelling why was a key motivator in us looking for a better way of providing care. So realizing that as a healthcare system, we want to provide the best care imaginable to those that need it the most. We needed a house. So what we did was we looked at other healthcare providers and some of the work that they've done. And so we decided to adopt Lean, and by way of Kaizen. Kaizen is a Japanese term that means good change or continuous improvement. So we actually partnered with Virginia Mason out of Seattle. They adopted the Toyota production system over 17 plus years ago, and they've successfully been able to implement it as their main management system for not only improving their healthcare outcomes, but also as a way of educating and teaching and empowering their staff how to identify opportunities, and then challenging them with owning those issues in healthcare. And in healthcare, we know that we've somehow gotten to this place where we've normalized waste, right? We've normalized things that do not add any value from the patient's perspective. So we're on that journey. So we've shamelessly stolen the Toyota production system. We're taking those basic lean concepts, such as, eliminating waste, level loading the work, focusing on quality, and really looking at the way we provide care from a process standpoint. So looking at every single step that's required to ensure that we're providing safe, defect-free care, and ultimately so that patients have what they need when they need it in the right amounts by who they want to receive it from. So looking at population health and developing these care teams, this is super important, and we want everyone in our system to be empowered to utilize these approaches, these lean tools and these Kaizen philosophies to do the best work they can in our system. So we're on that journey of adopting this, and we're not out of the woods yet. It's been challenging. The organization had a collective amygdala that is the part of the brain that triggers fear and fight or flight. We're all human, and so we've had to work through that. But we've slowly made some improvements in our system. We've allowed some empowerment of staff, and we're very much on that journey still.
Yeah, Abel, I think one of the great points too, and as an example of that, if you could hit on this a little bit, just the time that we were able to reduce someone being in one of our clinics to be able to receive care, the time from entering to exiting, that was a big win, right? In terms of being able to make that process more efficient.
Yeah, so we've seen this. We've actually engaged in a few improvement events, and to use one of our health centers in Fresno, California, we were able to observe the lead time being the time from when the patient arrives until they leave, looking at an average lead time of about 78 minutes, which was, very, observing that was very compelling. And you don't realize it when you're, in the hustle and bustle of all this normalized waste, but the patient was having to wait quite a bit in the lobby, and then in the exam room. Where we were vitaling the patient was in the hallway. So by the time we vitaled them, it's in an open space, and we're taking their blood pressure and their height and their weight, and so then they're anxious, and then we get them into the exam room, and we wonder why they have their blood pressure is up. So looking at all of these aspects of the way we're providing care from a patient's perspective, we were actually able to remove a lot of the waste. A lot of it had to do with pre-registration, pre-visit planning, preparing for the visit, externalizing as much of that visit before the patient arrives, so that when they hit the door, they get what they need. And we were able to reduce that lead time of about 75 to 78 minutes to about 37 to 40 minutes. It's not great, but it's good, and good is better than not doing anything at all. So that's just a small example of the way we're approaching. One last thing, these improvements weren't made by any of our executive team or any of our directorship. The opportunities were identified by the staff at the site, which was the most amazing part of that experience. And so we're feeding off of that, and we want more of that in our system.
Yeah, and that's a good point. The bottom-up decision-making and having everyone's voice be able to be heard. I want to bring in Jesus for this next topic, and it really comes down to the project management, how you dive into a lot of these lofty goals and projects, and how project management has really helped our cultural and organizational transformation. Jesus, talk about really that shared voice and those tools we've used to tackle a lot of these big projects.
Yeah, thanks, Tim. I think for us, project management, the way that it's contributed to cultural and our organizational transformation is that it's been a vehicle for change. It's kept us aligned and moving forward. And for us, transitioning away from the directive approach of project management and serving more as coaches, being able to empower our employees to live and breathe Kaizen in everything that they do. And then also helping to create a culture of feedback, encouraging those candid conversations about what is or what isn't working, and creating moments of personal reflection to be able to look at how our behaviors are driving or potentially stopping change from happening, and also creating intentional moments of learning and opportunities for our team to live out our new ideals and ways of operating. It's not the leadership making the necessarily making the decisions, but it's the frontline team members, as Abel mentioned, that are coming up with ideas, and we're there serving as coaches, helping them, test it out and collect data to see, if it's successful or not. And project management at Clinica Sierra Vista has allowed everyone to be a part of the, transformation, the innovation, and the continuous improvement work. Traditionally, the top to bottom management style isn't inclusive of everyone's ideas. And our new approach really is helping to activate the voices and ideas of our frontline team members and the people who will be impacted. And their voices are helping to guide our strategic objectives. We have a process that we do at Clinica Sierra Vista that I'd like to share with everyone called the catchball process. And this is a process where we vet our strategic goals developed by our board of directors and our senior leadership team to everyone in the organization. And when I say everyone, I mean, our ancillary departments, our clinical departments, our medical assistants, everyone in the organization has the opportunity, and we provide them a space to be able to share, their feedback on those goals and what their ideas are. Why will they work? Why might they not work? They're the ones, in the weeds doing the work. So it's important to be able to hear from them, and using that information in a way that's going to propel us forward, and it gives us the ability to be able to refine and guide our objectives. And when you're talking about continuous improvement and cultural change, it's so important that everyone in the organization feel like their voices are heard and that they're a part of that improvement and cultural transformation. It establishes a sense of ownership in the work and shared responsibility in making projects successful. So that's huge. And it also helps to eliminate that mentality that it's just another project that someone is making them do, and that, can limit buy-in sometimes. And using project management as a catalyst to be able to live out those principles that we're discussing today with you all, and preparing, it helps us to prepare our staff as well before we even begin the projects, and it helps to keep them involved during the process. And using project management as a framework and an example that through trial and error we can make incremental improvements that will bring value to our patients. And it really serves as an example that it's okay to fail sometimes. We won't always get it right the first time, and there'll be times where we make errors, but it's how we take those learnings and apply them to future projects and goals. And we have a saying that we use a lot in Clinica Sierra Vista called failing forward fast, and that just really is representative of that culture that it's okay to fail, and as long as you're taking those learnings and growing from it. And I think that project management in an organization that is actively changing is saying that it's okay to pause and reflect, creating moments where we're saying, are we on the right track? Is this where we want to go? Are we delivering the value that we had originally thought to our stakeholders? And using project management as a set of tools to stay on track. And, if we get off track for any reason, we're using that tool to realign the organization. And that's it, is that project management is a tool for transformation and not an ethos of transformation. So it's a tool under our tool belt and using that to the best of our ability. Yeah,
that's a great point. I like your point about the pausing, reflecting, analyzing. We've used that a lot with the vaccine rollout, how we're reaching our population base. Is it effective? We've had to pause certain things with testing too, and reanalyzing why we're doing this. Is it working? Let's take a moment and then get back on track. I'll stay with you, Jesus, for this next topic. You can share some of the methods and tools that we've used internally in that process that have really helped us through this transformation. Talk to us about how we've utilized the project management methodology and the tools to really live this out real time.
Yeah, I think for us at Clinica Sierra Vista, when you think of project management, it tends to be very rigid. You hear the word project management and you think of that traditional waterfall approach. And you're doing a lot of planning up front, and you're focused on that planning with a small group of stakeholders, and you're not necessarily gathering everyone's input in that planning stage, who's going to be affected. But and you're focused more on timeline and metrics, which are important, but it's not what projects and what cultural transformation is all about. Recognizing that there are many forms to project management. I think for us, it's been so important to keep an open mind that different projects have different needs, and every project is unique, and it's okay to apply different tools. You wouldn't use the same tools to build a house that you would to build a rocket ship, and recognizing that there are differences, and being very open to adapting and being flexible to that, and allowing the team and everyone involved to customize the tools based on the needs of the team. You might have some teams that are early adopters who are ready to use this newfound way of operating, of using Kaizen. You might have some team members who aren't yet ready, and so recognizing that and adapting the tools in a way that is going to be able to bring everyone on board, so that you have their buy-in. Most recently for us, in terms of tools, we've been moving more towards an agile approach to project management, and being agile's given us the ability as an organization to be able to pivot in times of volatility. I know 2020 was just a crazy year for everyone with COVID, and I'll use COVID as an example. There have been so many changing regulations, so many just changes surrounding that, and being agile and using that framework to meet daily and talk about those changes, and being able to pivot so that we're meeting the needs of our patients. And being agile has given us the ability to really reflect and listen to the needs of our employees and our stakeholders, and it's created a stronger communication channels, I would say. And the specific framework that we've used most recently is the Scrum Framework. So that traditionally is, for technology companies, but we've used kind of the basis of that and adopted it in a way that works for healthcare. And so, those daily 15-minute meetings are important to follow up on the project deliverables that we're doing. That's just really allowed us to be more cognizant of the things that are happening around us and within our organization.
Yeah, the Scrum meetings are great. I participate in one of those every day on the COVID vaccine testing and testing and vaccine. And so it's a great opportunity to, meet the team every day, work through things. It's been a great relationship builder too for us. I've noticed, especially in this digital age, we all come together at a set time. So great points there, Jesus. Thank you for that. I want to kind of broaden the conversation here and talk about, as we set out as an organization to tackle these goals and transformation with culture and procedures and new tools, there's been challenges, and there's been a lot to overcome: fear of change, changing hearts and minds within an organization. Abel, I'll bring you back into this conversation. Talk kind of globally about the challenges we've come up against and how we've worked through a lot of those and to move us forward.
Yeah, a lot of the challenges had to do a lot with our ability to be clear about the direction that we were setting. When we declared that we were going to use the Clinica Sierra Vista production system, that triggered a lot of fear and hesitation in many, because they hear the word production and they think about, we're just trying to maximize the number of visits that we're seeing, for the maximum amount of profit. Well, really what we're saying is, by taking a step back and looking at it from a process standpoint, we're now looking at managing the means and not the results. We believe that if we focus on the means, how we provide care, and be very relentless at eliminating mistakes that could potentially become defects that lead to patient harm, it's important to teach everyone in our system how to do that. So it's been about, as senior leaders, it's been about ensuring that we're very clear when we're explaining our commitment as an organization. And then it's also us modeling it and ensuring that we're living the culture that we would like to soon see. Culture is one of those ambiguous terms that a lot of people use, because people say, the culture, it's the culture. But really, as a culture is something that's cultivated over time. And so we believe that the more opportunities, the more we spend focusing on the process, blaming the process and not the people, and using the framework of Kaizen, which means respect for people and asking why in a meaningful way, and being really good at root cause analysis, and asking our teams, so what do you think? So it really is about coaching and facilitating their thinking process, and less about telling them what it should and shouldn't be. So as leaders, we've had to learn a lot. That's been a challenge, but I'll kick it over to Stacy for some comments too.
Sure. Thanks, Abel. So, I think one of the things that really became evident as we were trying to change our model, and we talked about, leadership transition and really trying to spark this new culture. And it was kind of taking your traditional top-down leadership culture and a bit of bureaucracy in a large organization, and flipping it on its head and saying, we want the staff at the front lines to really feel empowered to make decisions about doing the right thing for our patients, and creating a place where they would take action on that has been one of the biggest challenges. And so when you tell an organization and a group of people that we want you to do something different, there is a lot of fear around working outside of the framework that we gave you before. And now we're asking you to make decisions, do the right thing, even in some ambiguous situations. And there was fear around that. And so one of the things that we quickly realized is we have to create framework which makes space for staff. And so we started out with looking at policies and procedures and just very basic things like your employee handbook and how that's structured. How detailed are your policies? We had an 8-page dress code policy. And when I look back, I'm like, why does it need to be that detailed about what you can and can't wear? This is healthcare, and don't get me wrong, there's some parameters that need to be set around hand hygiene and nail length and wearing, closed-toed shoes if you're administering vaccines and working, behind the scenes. But the level of detail that was in there really created an environment where there was no breathing space and there was no room to be an individual. And that kind of, we realized as we're looking at these things that stifles innovation, and it stifles people from growing and really throwing out their ideas and participating and engaging in the way that we wanted them to. So, that was just one example. Another great example is your traditional discipline approach that we've had in place in our organization for many, many, many years, and trying to take our frontline leaders and teach them something new. We make I make the assumption, and this might be my glasses half full kind of perspective, but I always make the assumption that people don't get into healthcare to hurt patients. So if we make a mistake on the job, I assume it's not intentional, and that's not why you're here. So, that being said, our traditional discipline approaches say we write you up and progress that disciplinary action until we fire you. And that is very punitive, and it stifles innovation again. So we looked at that and said, how do we take this and really do the right thing in assuming the person didn't have malintent in this error? And how do we look at that a different way and use root cause analysis and lean to really look at what went wrong with the process, and how do we stop blaming the person that made the mistake and look at what contributed to that mistake? Was it a lack of training? Was it the process had room for error inside of it? What were the contributing factors to that? And really kind of taking that no blame approach first, and really figuring out how do we now make that the standard in an organization that's done it the other way for a long time has been one of our biggest challenges. And I got to tell you, when you change your policies and procedures and make them much more gray and vague, supervisors struggle with that. They were very uncomfortable with, well, it's not here in black and white anymore what I used to hold my employee accountable for. So how do I have that conversation with my staff member? And those conversations today look a lot different than they did a couple of years ago. Today, their conversations rotate around what's the right thing to do for our patient, and why is this rule, even though it's not explicitly written, why is this a rule that we should follow? And so that kind of cultural transformation and those growing pains are very real as you're on your journey.
Yeah, that's a great point. And I think, stifling innovation and being able to open that up and reverse that process is so key. And good segue to bring back in Abel, our Chief of Innovation. Abel, what effect have these challenges and getting through the challenges had on the organization? I mean, from changing hearts and minds to engaging people in a new way, how have these challenges really worked out the effect on the organization?
I think we're seeing the entire spectrum even today, and I think it'll be some time before we truly win everyone over. So for now, we're focused on those early adopters. We call them early adopters, those that listen to our why and were able to sit through our explanation of using Lean and Kaizen, and those are the ones that just ran with it. So we're focused on them. For the rest of them, the ones that are sitting on the sidelines and kind of waiting to see what happens, we're determined to make them curious, not furious. So if we can change the environment around them, if we can show them that this is the way, so to speak, that they'll come around eventually. So through continuous improvement, through empowering staff, through the process of using Lean and Kaizen, we believe that many, many, many small improvements over a period of time will have a great big impact as an organization. And we're talking about population health. I like to use the example, the largest taxi service, in the world doesn't own a single vehicle. That is true innovation. The largest movie producer on the planet doesn't own a single movie theater. So when we talk about population health and we talk about what's needed from an organization, it really is about decentralizing the way we provide care. So what are those next innovative steps? Health happens when it happens. It doesn't happen in a clinic. And so how do we get to the patient? Stacy mentioned that, we care for the needs of the homeless and other communities. How do we do that while at the same time maintaining that commitment to whole person care, to where we begin to see that health outcomes are improving without having to deal with or without using the episodic model of care. So the level of leadership that's needed for that is absolutely important. Change like this, it will not happen if your leadership is not aligned. So that has also been a challenge for us, but we're working through that. We've worked through that, I think, for the most part. So now it's living it, demonstrating it, and making them curious.
That's awesome. By the way, we have some good questions stacking up, so we're going to get to that in just one second. Want to end here with you, Stacy, and really looking back at this conversation and talking about what we hope to achieve in the long term with all of these benchmarks and these goals and all this transformation of the organization. What does it look like as you look ahead to the future for Clinica?
Absolutely. Thanks. So, I think one of the things that is really big is the innovation piece. And 2020 with the pandemic has been a great example to us of why an organization needs to embrace innovation, why we need to be able to pivot at a moment's notice and deliver healthcare in a completely new way. When the pandemic hit, we quickly realized we weren't in the space we needed to be in to do the virtual visit models and stuff that were really needed during this pandemic. And it took us 2 weeks to bring that technology online after discussing it for 2 years. So, sometimes the pandemic, as bad as it's been, has spurred a ton of innovation. And I look at the 2 years leading up to that as preparing for that journey and arriving in a space where we can do that. And really, at the end of the day here, we recognize that our populations around us are going to need different care in a different way. And that's going to keep evolving over time. So being prepared to do that is really, one of the things that we're trying to achieve long term. The other thing is really delivering healthcare in a new way. And so, it's been a while now, but over a year ago, we brought our teams into a workshop and talked about how do we create the delivery model in the clinic of the future. What does that look like in our organization? And, we're not the first to go down this path, but the team, really embraced a on-stage, off-stage model. And what is delivering healthcare in an environment where it's peaceful and calming for the patient? They don't see all the chaos that's happening behind the scenes at the nurse's station. How do we achieve that in primary care, and what does that look like? And our teams came into a empty kind of warehouse room with cardboard walls and built this clinic. And they built out what does the inside of the exam room look like in a perfect way. The patient enters one door, the staff enters the other door, and we engage in our visit. And what does that look like and feel like? And how do we bring the care to the patient in a different way? And so really, the long-term vision here is getting staff to really think in a new way about providing care, and not just it's a task that I'm doing, but I'm doing this task for the patient. How is it helping them with their healthcare outcome? And how am I providing it in a way that's respectful to them and that really is what they want from service, and kind of flipping the thoughts around how we deliver care in some way. This is not happening overnight. Our first clinics, these on-stage, off-stage concepts, will come to life this year in our organization. We're really excited about having those buildings being built as we speak. But it was the first time in our history in 50 years, the staff really designed their workspace. And it does look different. It's not the pod model that we switched to, 10 or 15 years ago. It's quite a bit different. And for our providers, it's very different as well. Working side by side with their support team and creating an environment where the care team actually works together as a team. So lots of fun stuff on the future, but the biggest piece is being ready to pivot at any moment when the environment changes.
That's great. And Stacy, you kind of you jumped into one of the questions that we received and sort of gave us a preview of it, but it's from Lindsay at Transwestern, and she was talking about after switching to the lean Kaizen management, have we noticed any areas of improvement in the physical layout? You were talking about that, Stacy, that inhibit efficient functions and attain positive outcomes for the patient. Either Abel or Stacy, if you could talk about we've piloted one of our locations here in Kern as this new model as we get ready to open up a new large medical office building. But talk about what we've done physically inside the space to talk about that transformation.
You want me to go, Stacy? It's really, so Stacy mentioned we have a new health center that's being designed around how our processes are going to deliver care. So processes, I like to say that form follows function. So validating the process through simulation and test of change can inform the way you lay out a space. But on the other side, I think we have 25 community health centers between Fresno and Kern. The question has arisen, what do we do with those layouts? Because a lot of them are poorly laid out and they just don't flow very well, and our teams are having to walk long distances. So in the spirit of lean and Kaizen, and when we say lean, we're not saying, eliminate people or do less with more. What we're saying is, understand what's happening today and figure out the most efficient way from getting to point A to point B without having the patient wait or without having the provider wait. So the teams have, in many of our health centers, they've done some pretty cool exercises on how to achieve that, given the poor layout. So it's really about the concept. And even if you have a health center that's laid out, not necessarily in an efficient way, you're still we're challenging the teams to apply the concepts to figure out the best way to do that. And we hope that as we grow in the organization, we now have a model, as Stacy mentioned, that we can follow of the on-stage, off-stage. Yeah. Yeah,
and I think, Stacy, you were talking about it. There's, in this new layout, there's sort of a tranquility aspect to it, changing even just the visuals that a patient sees when they first come in. Obviously, traditional clinics, Abel talked about it, why is their blood pressure raised as they get into the exam room? We're doing things intentionally to change even what you see when you go into a clinic.
Yeah, so, we've really kind of taken a different approach to even how it looks and feels when you walk into this space. And really, we're working towards how does self-rooming look as a patient, and what does it mean to a patient to be able to walk into a facility with very minimal front desk intervention and self-room into the visit room, and really, how do you create an environment where that's possible? And so, using signage and wayfinding and laying things out in a way that people of varying levels of understanding, literacy, and other things can make sense of your facility. These things aren't going to happen overnight, to be very honest. We are PDSAing them, for lack of a better word. But, creating that environment in a new way is great. Abel started hinting on another thing, though. We have a bunch of other health centers. And so what about the clinic that's not laid out perfectly? How do we make a difference there? And we're working through those things one day at a time. But I got to tell you, it starts with small, incremental little improvements. And so one of the tools that's a typical lean tool is 5S'ing, the sorting and organizing and really, having the staff do this of their work. And they've come up with really cool things about how do we organize our supplies in a new way? How do I put together kits for procedures and other things that reduce the setup and the waiting for the patient? How do I even organize our space in a new way? Yes, I can't tear down walls and do some of this other stuff, but can I organize the space a little different so, the patient walks less or, and really kind of looking around and go, this is what I got in front of me today. How do I make the best of it? And working through those pieces, because at the end of the day, not every organization is going to have the financial means to tear down a building and put it up the ideal way. And in our changing healthcare environment, the ideal can change overnight. In the instance of like a COVID, we got to screen you at the door before we let you in the facility. That we didn't design our facilities for that. So how do we set up for that and really create that space where we're flexible and able to do things in a different way?
That is great. Well, we have kind of reached the end of our presentation here. Got to one question. If you have any other questions, please get those relayed over to us. I want to thank again our panel, Abel, Jesus, and Stacy from the organization here, Clinica Sierra Vista. You can see our website on the screen there. It's clinicasierravista.org. We'll also share our email addresses with you as well. So if you have any questions, I just saw Jennifer there, our moderator. She has put our email addresses out to you all. So if you have questions, you can reach out, of course, individually. So we'll stay on here for a few more minutes if anyone wants to hop on and ask a question. Quick note to our website. We're going through a transformation there, launching a new site soon with the same address there. So you can kind of see how we've adapted some of our, with testing, COVID testing and the vaccine. In California, we're doing some pretty innovative things with how we're scheduling our patients, how we're reaching out to them. So some exciting updates will be coming to our website. You can check out as well. In lieu of a question from the group, I'll just fire one away. And something that I think is interesting, we talk about people and as an organization trying to manage and reach out in a new way to spark collaboration. How does variations in personality come into play about talking about culture change? Maybe Stacy, you can talk about that. Just understanding, you talked about discipline changes and how you deal with folks, but how has personality really played into that?
So that's a great question. And I think that is one of the biggest hurdles in any cultural transformation are those nuances about us as individuals. And so we've identified 6 values in our organization. And one of them, and probably one of the most important in that, answering this question, is transparency and respect. There's really 2. And creating a safe place to be authentic as an individual has been a really important part of that. And then having a value that we really claim is, transparency. And so, actively asking people to share who they are, and being comfortable with your team to say, here's my strengths and what I can contribute to the team. And here's my weaknesses and where I might rely on others to do that. And then, the team also embracing that other value of respect and really respect means more than just being nice and gracious. It's giving people the bandwidth to develop further as well and to work together in a new way that is, not necessarily, oh, you're struggling, let me jump in and do it for you. How about let me work next to you and help you through that so that you're more comfortable with this next time it comes up? Or, just really relying on some of the values that we've identified to say it's okay to be different, and being different really helps spark innovation. And so it aligns with where we're trying to go. So how do we embrace that in a new way? It's being really transparent about who we are, where we're at in our understanding of what we can contribute to the team. And then also stepping back as an organization and looking at what's our diversity and inclusion strategies here as an organization. And are we meeting that not just for our patients, but for our staff as well? And that is our nation's challenge, but it's our challenge as well. Even, more so when you're targeting and trying to take care of populations that come with substance abuse and homelessness and childhood trauma and other things that really, honestly are stigmatized in our culture. And so, really having transparent, honest conversations about where are we at and how do we do a better job of taking care of these patients. It's vital to organizational success that we do that.
Yeah, that's great. And I just want to share a comment. Thank you, Lindsay, for engaging with us here. She says, love the presentation. Thanks for making an investment in a meaningful change. UT Austin and Del Med have implemented something similar that we might be a beneficial reference to us as well. So thank you for those, the question and the comment, Lindsay. Appreciate that. Jesus, well, we got some time here. And Stacy was talking about inclusion and really being part of this new way of looking introspectively to your organization and the people in it. Talk a little bit about how we've redefined success within our leadership and within leaders, and including that process of looking at diversity and inclusion, how that really has played out.
Yeah, that's a really good question, Tim. I think for us at Clinica Sierra Vista, redefining success away from that traditional approach where it's like the savior method, where it's you have a leader who can come in and they will change everything up and say, I have all of the solutions for you. That, isn't what it really means to be successful in our organization. We're moving more towards shared decision making and being able to give the skills and the tools to everyone in our organization to be able to identify the changes, that are needed, and giving them the skills, I guess, that maybe traditional in other healthcare organizations that are a little bit more traditional don't give their employees, and really bringing them on. And I think as a leader, success means giving those skills and empowering your team to be able to, get to the finish line, and you're there being more of a servant leader, more of a coach. And you're not taking all the glory for yourself, because that's not really what it's about at the end of the day. It's about how are we serving our patients. We work in an underserved community. And so it's about how are we meeting their needs. And repeat the second part of that question, Tim.
Just how that's really supported a lot of how we're looking at the whole employee, the whole person, with including them in things.
Yes.
Yeah.
Yeah, no, I think for us too, we're at the very beginning stages of that. We formed we saw the need for a diversity, equity, and inclusion committee. And so again, that really, we're living out our principles. It's not a group of senior leaders saying, this is how we're going to change our organization to be more diverse, to be more inclusive and equitable for our employees and our patients. But, we're allowing our staff who has a little bit more experience with our patients and who see firsthand some of the gaps there, and we're allowing them to come up with a vision and a strategy, and we're here to help them execute that. And so we're at the very beginning stages of that. So it'll be really, I'll be really curious to see some of their ideas and strategies to for change.
That's a great point. Abel, one kind of thought question to you as our Chief of Innovation. We're in a digital age. Not only how we deliver medicine with our patients, telemedicine, telephonic visits, but internally with the staff. Obviously, this format has become the norm, virtual. How have the need to take it virtual and some of the big challenges within that process, how have they potentially stifled innovation, but also supported it? How have you broken through a lot of those barriers in this Zoom, Teams, virtual conference era?
So whereas us as leaders, when that need arose, I didn't necessarily know what we were going to do. So I put it to the team. I said, how do we do this? We have a learning program. We call it Lean for Leaders, just to use one example. This is where we take, our directors and our managers, and we're teaching them a deeper level of Lean and Kaizen. And it's more about facilitating the improvement work and less about doing. So if they have direct reports. So that was a challenge because part of the curriculum involves a lot of field work. So we've been able to dismantle that a little bit and spend more time one-on-one, and kind of bypass the need to necessarily meet altogether. But when we have, we've done it in innovative ways. Like everyone's in a different room and they're using the whiteboard and We use Microsoft Teams. They're sending each other their work, and they're kind of doing it on their own. As an organization, we haven't necessarily had to mandate that it be done a certain way. We're kind of giving them the tools, and they've kind of ran with it. So we've leveraged that. And as the restrictions have lifted, as more and more of our staff are vaccinated, we're allowing a little bit more of a bandwidth for them to come together. But it was really about putting it up to the team, and it'll continue to be that.
Normalizing virtual high fives over the over the Teams channel. Yeah, that's great. Well, thank you all for participating. Thank you for the folks who are watching. It's such an important time in healthcare, and thank you for what you do and being part of this this journey with us. As Jennifer, our moderator here on the back end, has put our email addresses out to you. If you have questions, please feel free to reach out, and we look forward to connecting with you as we all together move through this this crazy year.
Thank you all. Thank you, Jennifer.